Hello, Alex Martin here again from Metro MD. I would like to discuss with you now stem cell therapy for hips. The 21st century has now offered us many options where we traditionally have placed a titanium rod or completely replaced the hip. We now are able to utilize stem cells in an attempt to slow down the progression of the disease that leads to the hip dysplasia. At the present time, we're able, if we can catch the disease process at an early stage where we see decrease in the cartilage, destruction of the joint itself at a minimum, we're able then to inject your own stem cells into this space around the hip, restoring the cartilage and preserving the bone so that the bone is not destroyed. This is really our goal. Early intervention, early detection is the key, and that will be a way for many of our generations to come not to have to go through the hip replacement procedures. Why don't we want to use the traditional procedures? The reason is that the procedures have a certain risk to them. There's the risk of infection, there's anesthesia, there's a risk of blood clots from the legs, as well as all the downtime entailed in the convalescent period post-op. That's a major reason why we would like to have an alternative to the conventional replacement of the hips. How do we do this? How are we able to have an alternative? It was discovered almost 6 years ago that we ourselves, adults, have sufficient stem cells in our bone marrow that are going to act just in the same way as embryonic stem cells. They're able, once placed inside the joint, to regenerate cartilage and soft tissue. This is a very exciting discovery because it means that the procedure of stem cells treatments for the hips is safe. It's something that we are applying our own body tissues into our own body for regeneration. We are able then to regenerate the cartilage and the soft tissues surrounding the joint, preventing the bone-on-bone destruction, which will trigger the necessity for total hip replacement. So by prevention, we can then continue to preserve our hip joints and not have to endure the risks of a full hip replacement surgically. So this is a little insight into what's going on in the 21st century in the treatment of hip disease and hip degenerative disease in particular with stem cells, your own stem cells. Again, this is Dr. Alex Martin. I'd like to welcome you. Give us a call at 323-285-5300, and you may also email us at info at metromd, that's METROMD.net. Thank you.